came together as a community organisation and a hospital, we recognised early that this organisation is in the community in all respects, and that we don't only have patients, but we have a population, and we want to create a new dynamic between our population and users of healthcare, which recognises a different power dynamic than perhaps previously.
It was very much about people finding their own resources within themselves as much as possible to kind of take charge of their health conditions.
Just state your name and just one thing you do to self-manage.
I've had a lot of mental health problems. I want to give something back, so I volunteer all around the community.
I usually distract myself by listening to music or reading or doing art.
It's very much about seeing the person as a whole person. So it's not just about the biomedical stuff that's maybe going wrong with their bodies, but it's about the social impact of that, it's about the emotional impact of that, and it's about how we can support people to live life with all of that and manage their conditions in the bits of time when they're not with the healthcare professionals.
I think the beauty of it is in training patients as well as clinicians and managers getting involved in the systems change. We're really slowly kind of tackling it from all sides, and that is what eventually brings out culture change.
What we know is that when people are more engaged, they have fewer adverse events, their outcomes are better, and they have higher satisfaction levels. Also, within the hospital setting, we're doing quite a lot of work with people when they're in hospital in an unexpected way, as an unplanned admission, supporting the staff and the clinicians to work with them to understand that they've got a role and to support them to get better quicker. This is a model now that is being adopted nationally. It's known as the House of Care. I think it really helps to have that as a framework for putting all the different bits together.
Other departments dealing with long-term conditions recognised that there was a new enthusiasm and there was a kind of paradigm shift in the way the diabetic department was working with patients, and that training their whole department in these new techniques had breathed new life into managing this particular chronic disease, and I think the other departments were interested in that.
What's important for me is really take a holistic view, so not just look really at the physical problems that diabetes causes, but also some of the social and the psychological issues, and to address them more holistically together with the patient. So overall, what I feel what self-management really does for me, or this collaboration, and actually improves the quality of the consultation, makes us more effective and has a much more open dialogue with the patient.
The population is changing and we're seeing people living longer. As a result of that, they're going to have more long-term conditions and other significant medical problems such as dementia. Most people, when they have these conditions, will possibly spend a maximum of 3 hours with their health and care professionals, and the rest of the time, 8,500 hours looking after themselves.
What we're doing is we're asking each individual clinician and manager to do something different. We're asking them to stop doing what they've been taught to do, which is tell people what to do, stop smoking, exercise and so on, and work out instead what is really important to this person and then help them to achieve that.
The board, from a top-down perspective, has a wide number of priorities, and it's really important that a voice for self-management is at the top level of the organisation in some way.
When you hear about the difference it makes to people's lives, it is so rewarding. It means that, some people are getting up and going out for the first time ever. It's as fundamental as that, getting back and living life again.